most impacts, the barriers, if you would, to healthcare in the NHS when you're experiencing homelessness is the ease of accessing treatments when you want, need, or can physically access them. And so I think the best example for me would be teeth. I have a brother who's been a dentist for pretty much all my life, and therefore I had really, really good teeth. And he retired, and finding a new dentist experiencing homelessness was an impossibility. I needed root canal work, which thankfully a person on Harley Street did for me, but that wasn't the NHS. If I needed that work, I couldn't get it done. And the juxtaposition of those two positions was when I was suffering with pain and I had to go to a fete inside a ramshackle room at the back of an office to see a dentist who was part of Street Fest's homelessness annual event, and then was passed to a community dentist who went, oh, well, we can just shove and have a wiggle around and hope we get it. And I was like, no, that is most definitely not happening. So the obstacles are often technological. You'll find that I recently went to a hospital and it asked me for an address to log in. Well, I'm experiencing homelessness. I don't have an address, but there was no option to do that. So as it happened, they had an old address that I hadn't lived in for 15 years in the system, and I used that to get in. But there are technological barriers, simplistically just checking in to get access to a hospital appointment. But the key thing I think in that context is so many people don't have a GP. You need a registered GP who's yours. And it shouldn't matter which area you go to, it shouldn't matter what you do, because they need to be continuous. There's no point going from one doctor to another doctor because you end up repeating yourselves. They won't notice physical changes in your body or differences in your mental behavior. So it's someone that needs to know you for a considerable period of time, and that you can always rely on being able to get to see. And often, as most people will know, is that actually registering with a doctor without a physical address, whilst it should be very easy to do and is completely compliant with all laws, many receptionists at doctors' practices will tell you they cannot register you without an address. The one thing I'd recommend to health policy leaders, politicians, when it comes to the inequalities in health is listen to your patients. Listen to the people who are coming in. Time and time again, I've spoken to the chief executive of trusts and I've gone, look, this is the problem. I can't get into your people think this is happening. And then I'll get feedback that goes, oh yes, Paul, that's really important. And then nothing changes and I'll hear exactly the same story from somebody in one of my other networks. Most problems are easily identifiable and easily fixed if you listen to the user, the patient, the customer, whatever terminology you want to use. But they're the people you exist for. There's no rhyme or rationale to have all of the systems, all of the healthcare, all of the drugs, if actually the people that need them aren't getting them.